Hello world, in today's presentation, the topic that we are going to present is an ongoing one. A problem? Yes, is the new coronavirus. Before we discuss it any further, let's talk and learn something about the country where it all started, China. China is the most populous country in the world. It has 1,395 million people living in the border. It's the first economic power around the world. It is governed by a communist party. In the Chinese capital, Peking, there are 21.54 million people living there. The president of China is Xi Jinping. He is 63 years old. The official language is Mandarin Chinese. China stands out for being the oldest civilization in the world.
Some facts. China has the largest dinosaur fossil record in the world. There is a dish called eggs we boy virgin. This is considered a delicacy. The funny thing about this is that it is cooked with young's urine. Uniformed men use needles in the collar of their shirts in order to maintain an upright position. The country has a specialized camp to combat internet addiction.
After learning a little about the country and its culture, we move on to coronavirus. Coronavirus, which official name is SARS-CoV-2, is a newly discovered virus that causes a respiratory illness. Home symptoms are fever, coughs, and respiratory distress, causing the disease named Covid-19. Where did the coronavirus start? Covid-19 started in Wuhan, China, specifically in a famous market that had livestock animals and sold multiple animal species. How is it spread? It spread from person to person by the respiratory droplets from the upper respiratory tract. What are the symptoms? Commonly, it starts with fever over 38 degrees. In some cases, shortness of breath, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea.
How to prevent COVID-19. Avoid places with crowded people. Cover your mouth and nose when you sneeze, not with your hands. Stay away from sick people. Good hygiene, especially washing your hands for more than 20 seconds. When is the right moment to use mask? If you're healthy, you only need to wear a mask if you are treating somebody in which the infection of COVID-19 is suspected. Wear a mask if you have cough and sneeze. The masks are only efficient if they are combined with frequent and washing with water, soap, and a hydroalcoholic solution. If you need a mask, learn how to use it and dispose it properly. How to put, use, dispose, and throw a mask. Before putting on a mask, wash your hands with an alcohol-based disinfectant or soap and water. Cover your mouth and nose with the mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while wearing it. If you do, wash your hands with an alcohol-based disinfectant or soap and water. Change your mask as soon as it is wet and do not reuse single-use mask. To remove the mask, remove it from behind. Do not touch the front of the mask. Immediately dispose of it in a closed container and wash your hands with an alcohol-based disinfectant or soap and water. Is there any treatment currently? There is no treatment available as right now, only treatments to relieve symptoms. There are currently more than 140,000 cases in 113 countries. Deaths have been recorded in China, Italy, Iran, France, South Korea, Argentina, and USA. More than 80,000 cases in China. Of those, they have registered 31 and 94 deaths till the moment. How quickly the disease spreads has led several countries to close their borders with China, Italy, Spain, and also with Iran. The entry of citizens of European countries with cases such as Italy or Spain has also been banned, which took the measure of restricting travel to Israel or Iraq. The US has also closed its borders to European travelers.
Every continent in the world has presented cases with positive coronavirus testing. It was declared a pandemic by WHO. Actually, it's on level 2. It has generated panic and public hysteria. Having an accurate estimate of the incubation period for COVID-19 allows epidemiologists to assess the outbreak dynamics and therefore design an effective quarantine for its control. The incubation period for COVID-19 has been estimated to be 5.1 days, and 97.5% of those who develop symptoms will do so within 11.5 days of the infection. 2020 coronavirus disease pandemic in Chile. The first case of the 2019-2020 coronavirus disease in Chile was confirmed on March the 3rd. He is a 33-year-old doctor from the county of San Javier in the Maule region, who was admitted to the Talca Regional Hospital. The man came from a flight from Singapore. To March 16, Minsala has confirmed 155 new cases of coronavirus in Chile. 2 patients with COVID-19 are hospitalized in serious condition, one of 22 years old and the other of 44. Actually, the country has entered phase 4. It refers to the sustained transmission with no traceable source of the virus in the country, which is what's already ongoing, not only in our country, but in others such as Italy and Spain. The health minister also announced that all passengers on a cruise ship located in the south are in quarantine and will be evacuated. Finally, the government has announced the closure of the border, which will start Wednesday, March 18. This is not a call for hysteria. We should be worried, not anxious. And we should take preventive measures to ensure that people in the risk categories are safe.